Call to order the Winnebago County Community Mental Health Board, Wednesday, March 5th at 2 p.m. Roll call. Dick Hunter. Bill Gorski.
Here.
Oh, yeah, sorry about that. I'm doing it in the wrong order. Mary Ann Abadi here. Andrell Bradshaw.
Here.
Dr. Copeland.
Here.
Dr. Giardini.
Here.
Dick Hunter.
Here.
Margie Lindmer. Tim Neighbors.
Here.
Jeff Nielsen.
Here.
Dr. Penny. Mohammed Yunus. Okay. Moving on to, there is no public comment requested at this time and no presentations. So moving into our monthly activity report, Jason, do you want to highlight?
Sure. So there will be a Rockford Area Case Management Initiative conference on Friday. That's going to be one of the focus sessions. Will be focusing on case management programs that have had successful outcomes that have been funded by the Mental Health Board. So we're looking forward to that Friday. We coordinated with them over the past month on that, and Mary Ann will actually be moderating that session. So we're looking forward to that. And seeing some of the great work that the programs have been doing. And then we also had a really good session with being facilitated by Scott Block, who's the State Behavioral Health Administrator for the Illinois courts. And we combined our Learning Network Collaborative of funded agencies with the Criminal Justice Coordinating Council and had all of those organizations show up together to do a sequential intercept map update. And so when that all gets finalized and updated, that will show kind of mapping out behavioral health services throughout the criminal justice system. And we will certainly bring that information back to the board when we have that updated. But it was really good. I think there was probably roughly 75 organizations in attendance.
We had a lot of tables.
Yeah, we had a lot of extra tables because it was going out. Really, really well done. Interesting workshop. Really well done.
Terrific. Is that it for
That's it.
updates? Okay. Going into action items, I will need a motion for the February 2025 meeting minutes to be approved. And Dick, thank you. Any corrections, any further discussion? Hearing none, all in approval, please say aye.
Aye.
Okay. Moving into resolution 2025X, authorizing audit waiver for program year 4.
Yeah, and this just falls into the same bucket of what the board had reviewed, I believe it was last month or 2 months ago for MCME, where it's an organization whose budget now falls under the state threshold requirement for an audit. And so they would be requesting to do a professional financial review in lieu of an audit because the audit process is more expensive, essentially. And there is a representative here from that organization if you have any questions.
Okay.
How often will that happen, the professional review, financial reviews, yearly or?
It happens annually, that's correct, and it will depend on the level. Each year it's determined by the level of revenue, whether it's state awards or whether it's just revenue control.
Great, thank you.
Okay, any other questions, discussion? Okay, I will need a motion for approval for the waiver. John? Carrie, thank you. And this is just, okay, all those in favor, please say aye.
Aye.
Opposed, same sign. Okay. Moving into the next action item, and that is, hang on, I have to turn my page. Resolution 2025XX. And this resolution is in regards to authorizing the Winnebago County Community Mental Health Board funding an allocation of special project funds for accelerator award. Resolution 2025 is authorizing the Winnebago County Community Mental Health Board funding and allocation of special project funds for the following organizations: Rosecrans Inc., Empowerment Hub for $231,805, and the Winnebago County Juvenile Detention Counseling Center at $1,027,133.37. I would need a motion for these to be approved.
Second.
Second,
Discussion if they're good,
pardon me?
discussion on this one,
Yes,
on the juvenile. Mentioned it last month, and the amount now has been dropped, and I realize that's because that's all we have left. Went from 2 million to 1.02, which I understand. But I just want to be sure we agree we're not putting the cart before the horse on this, when they're doing a space study, which is probably about to start right now as we speak. This money was to be allocated over 2 years to get the 4-room addition. I just want to be sure that we agree that, again, we're not putting the cart before the horse. I have learned from Tim, he mentioned last time there may not be enough land, but now it says they discussed it, and there is enough land with the architect. But with their space study, they're going to be looking at the whole juvenile detention facility to see if there's more they can do. And I guess I'm thinking that we could do the 4 rooms at a certain cost. If it's part of a bigger project, it might be cheaper. So I'm just tossing that out for thoughts and discussion. That's kind of my point.
so do you want to amend this resolution to separate the detention from Rosecrans Empowerment Hub?
Yeah, I'll make a motion to separate the two.
Okay, anybody?
A second.
Okay, you second, all right. All those in favor?
So
Is there, do I need roll call?
no, just to be clear that everyone's voting on, because there was a motion and a second for the resolution, so to be clear that you're voting on the amendment.
This is the amendment, not the funding, right? Okay, so all those in favor, please say aye. Okay, so, we'll go back to the amendment for funding of the Rosecrans Empowerment Hub, and then move back on, okay? So, pardon me?
So, never
All right, so, we had a motion and a second, so I'll do roll call.
mind. We only had a first for.
Oh.
So actually we have to get,
I thought we had a first and a second for both.
I only had a first, the
Oh,
Jeff product.
Second.
You second, okay, sorry. I didn't hear.
okay. Do we understand now that we're voting on the funding for the Rosecrans Empowerment Hub? And Andrell Bradshaw.
Nay.
Dr. Copeland.
Yes.
Dr. Giardini.
Yes.
Dr. Gorski.
Yes.
Dr. Dick Cooner.
Yes.
Margina Mark. Tim Neighbors.
Yes.
Jeff Nielsen.
Yes,
Dr. Penny. Mohammed Yunus. Mariana Abadi, yes. So with that, part of the resolution has passed. Moving back now to the amendment, is it, does anyone else want to add to the discussion here for,
Chair, I
Jeff?
should add that I have no doubt they need the space. There's no doubt they need the rooms. But just to wonder if we're spending money before they can do better. But I'm just tossing out the discussion.
Sure.
So I think, we're still safe in the simple fact that we give the money out, invoice based. So they only get the money that they spend and then they have to come back and get reimbursed for it. So if they don't use it, then they won't get the money either way. We just allocate the money. Just in case they, get what they need.
So Jeff, so your point is that if we could do this cheaper, why not? Is that's
Somewhat, yeah,
that's your
because, I
question?
mean, the initial ask was 2 mil.
Yeah,
We're only getting 1.02 because that's all we've got left.
correct.
And if I heard her correctly when she spoke, the space study is being done now.
Right,
So they may within a month know that it's gonna cost them, for what they want, 6 mil, but if we separate this out, this may be 2, but we could do it as part of a bigger project a lot cheaper. I'm just bringing it up for more discussion, that's kind of where my thoughts were.
I remember reviewing this, but I don't remember the details. I don't have any problem admitting to the degree that Chief Nielsen is. And I'm concerned now that, just to throw it out, is there any problem with deferring this for a month and coming back with answers to the very legitimate questions that he's raising? Is that a problem from a timing perspective, from?
For the accelerator work program, there is no deadline for making decisions. There was a deadline for submissions, which has already passed. There are 3 additional pending proposals that presumably would be decided only if this one was denied, because if this one is approved, then it would utilize the remaining $10 million. So I think the short answer to your question is no, that's not a problem. It would just put any other decisions on pause until this decision is made.
It can be tabled, so this decision can be tabled for next week.
So we asked them to come back in next month and give an update on maybe what the space study is and where that whole thing is gonna go.
yeah.
So, just a thought.
I mean, that was really, well, what we wanted to do was the number one set of priority that we want to be a contributor to this project because again, we see it as a high priority. And so given the set of circumstances, it was kind of like making this commitment of $1 million to them to make sure that we were going to make this contribution for their counseling program. So Jeff, it's still not settled in terms of like, will they need it? But if they don't need it, we won't give them that much money. I mean, that's the way it works.
I have 2 cents to put in on this. And Jeff, you're right. I'm sure they need the space. Having taught out there, for 6 or 7 summers, it really does need more space. They have 2 classrooms that are very small, and unfortunate, when you have that many kids that are being housed out there at the time, we were using the cafeteria as an added classroom, and they were using the gym for the kids to sleep in because there just wasn't enough cells. Another unfortunate thing to say, however, times are changing, we see that. I think, I'm all for tabling it for another month, and yes, have them come give a presentation. I'm all about, verify for us, trust but verify. But I'll just say, from being out there all those summers, that place is in need of an upgrade.
That was on the site visit. I mean, there's no doubt they need space.
Yes.
But I'm just concerned about $1 to $2 million when it could be done for maybe a quarter of that if they want a bigger project. It's gonna be about the same time.
Yeah.
So that's where I'm at.
Yeah, okay.
Just trying to figure this
Why
out.
do you assume that it's going to be less money? I mean, the most we'll ever be able to give them now is the 1 point, whatever we committed to. Because that's the end of the accelerator fund. So why are you assuming it's gonna be less than, that 1 million?
I'm not assuming that, but I'm saying as part of a bigger project, the architect may be able to say, hey, we can do those 4 rooms for $750,000 if they're part of a bigger project. But if you do a standalone, it's gonna cost you 1.85. I don't know the answer to the question. I'm not in that business.
Yeah,
But I'm just wondering if they're doing the space study now, they may have an answer to that and say, hey, we know it's gonna cost 2 million either way. And we say, hey, there's 1.02 like we just said. I can go either way, but I agree with Terry, they need the space. There's no doubt. I've seen it, I know it, they need it. There's no doubt about
yeah,
it.
I say the other thing, well, I have no problem waiting, because I thought that's what we were gonna do anyway, wait till after the space was done to, cause they said it was done after March. So I thought that's what we were gonna do anyway, but, the other thing was, remember they said they're doing it in phases, and this was the first phase. Yes, that was the other thing, so I don't know if it would have been cheaper, because they were doing it in phases or not, but, this is the first part of the project. If that helps.
Yeah,
Well, I just don't hear anybody questioning the need to do something at the center at all. Now that Jason, you reminded us that this taps out the remaining funds in the accelerated program. To the chief's point, it could be engineered into lower cost, and there may be some money left over for a pending project that would otherwise be shut out from something. So, am I correct? Because if we award this, then we're done, the ones that are pending are done.
Correct.
So personally, I'd say I'm in favor of tabling it, having them explain and answer in detail the questions that you have, because at that point, if it can be done for some of us, then there may be something left over for some other worthy project.
Or for a rainy day.
So,
okay, so we'll need a motion for that, for table,
I'll make a motion to table.
okay,
I'll second it.
okay. And this would have to be a roll call, correct?
Let's just make it.
Sure.
Yes. Okay, Andrew Bradshaw. Aye. Okay. Dr. Copeland.
Aye.
Dr. Giardini.
Aye.
Bill Gorski.
Aye.
Dick Cooner. Archie Winmore. Tim Neighbors. Jeff.
Yes.
Okay.
Yep.
Jeff Nielsen. Dr. Penny. Mohammed Yunus has arrived, so. Mary Ann Abadi, yes. Okay, so that has been. All right,
And so, okay, so now that it's been tabled, could I get some clear direction from the board? Would you like me to invite this organization to come for a second presentation at the April meeting and give us a status update on the site study essentially?
Right there, exactly.
All right, we will do that, thank you.
And and since they're doing it then, we could, vote on it then too, right?
Well, yeah, because the resolution is now tabled, so you could vote to take it off the table and vote on it for an action item, correct? Yep.
Have we given some type of deadline to those pending applications as it relates to when we were going to?
I have communicated to, I've communicated to at least some of them. I'll have to double check if I've communicated to all of them that those decisions could not be made until the current decisions are made because they're being determined in the order that they're received. So, thank you for reminding me to make sure that we've communicated to all of the remaining 3 organizations.
And there's 3 more?
There's 3 remaining, yes. And I believe they've been reviewed by the board members already, we haven't done any additional steps in this.
Could any of them presented?
No, they haven't.
okay. Moving on to discussion items. The first one is the publication of the annual report fiscal year 2024.
So this is just, does not require an action, just wanted to let the board members see the report before it's published. If you have any, see anything, you have any direct feedback, or you see an error, a typo, Jeff caught a typo for us, so appreciate that. Any of you that are diligent reviewers, I know Dick tends to be one that can find a couple typos in there for us, so just take a look at it. More eyes, the better. We do our internal reviews, obviously, as well, but it's good to get somebody that hasn't worked on it to review it. And then, what's our kind of deadline for that?
So feedback from board members, end of day this week, Friday. But if you like the weekend, I can give you until end of day Monday. What is your preference? Do you want the weekend?
Have it please done by the end of day Friday.
Okay, let's do Friday.
We really need to get moving forward with it because we have a statutory deadline on this. It's dictated by the state statute that the annual report has to be published in a newspaper by a certain time period after the fiscal year
Is
closes.
there a formal response to this, or just say it's okay?
No form.
Oh, yeah, I don't need to vote on it.
There's no
Just give us-
formal review, I mean, there's nothing I have to fill out to say it's okay.
Correct.
I sent you a couple of comments, and that's all.
Yeah, so if I don't hear anything from you, I'll just assume you're good with moving forward. We found a couple ourselves, you know, it's just, so memorize it better. So if there's no feedback from you guys by Friday end of day, we'll just be moving forward with our final draft, update, and then it will go towards publication. We'll put it on the website.
One more comment? Very well done. Pass it on to the staff and yourself. Very well done.
Thank you. That was led by Chelsea, but it was a team effort. I'm going to come up here and do a quick presentation. And I'll just do a screen share, so it's out there for everyone watching as well.
Excuse me, Jason, I have a question.
Yeah.
Was there a language change from severe mental illness to just mental illness?
No, I think there should. I don't believe so. Yeah. Serious
Mental.
illness.
It's serious mental illness and then serious or severe emotional
Emotional
disturbance. So
disturbance.
it's serious mental illness and severe emotional disturbance.
For the children.
But there has been in some of our plans, place where that it could be interchangeable, just like substance use and substance abuse. So, but if there's a point where it says serious and says severe, please let me know and I will make those updates.
Okay. Okay, state statute, since we're talking about statutory requirements today, also requires the board to develop and operate a 3-year strategic plan and to review that annually. We're not required to make any changes to the 3-year strategic plan on an annual basis, but we need to at least review it and see if there is an opportunity for update. I would like to give you a brief overview of some key updates in each of those objective areas. And then we are going to send you a heuristic device questionnaire, electronic questionnaire that you can fill out. And it will kind of facilitate some of your thoughts about should things be added, should things go, anything that should go away, that sort of thing. And then we'll kind of aggregate that feedback, have some facilitated discussion at the next board meeting to kind of present back to you, here's what we're seeing, here's what we're hearing, here's what we think from our work, working directly on these objectives, in terms of if anything should be added, deleted, et cetera, okay? So just high level updates. You know, we had a lot of objectives last time, and that scared me, and some of the feedback that came from board members was like, wow, these are a lot of objectives. And putting this together, I was surprised by how much progress actually had been made on a number of these. So please remember the goal area number 1 is programming. So that's really that direct service programming that comes out through the grant programs. Strategy A is focused around the community research, really identifying what the needs and the strengths of the community are. We do that every 3 years as a board. We have done that process for you with the environmental scan survey and public participation surveys, and then the kind of public comment period. In addition to that, though, even as we speak, we have gone through this process now of the sequential intercept mapping update process, which is supplemental to that research, and have the accelerator work project, which is the Guidehouse, which is the name of the consulting group who is doing a deep dive into Winnebago County mental health and substance use service needs, strengths, gaps, etc. So that's kind of the primary activity that's happening in that space right now. Identifying population and service needs lacking, I would say just repeating those first 2 points. The point of that research is to identify the needs and any service gaps. In addition to that, the site visits, when we do the facilitated site visits, we have some recommended questions, and a lot of those revolve around the agency. In addition to kind of their compliance monitoring, we also are asking them, what are they seeing? What are the gaps that they're noticing, whether it's from care coordination or if it's client needs that are not being addressed. And we try to capture all of that feedback in a site visit, kind of post-site visit report. And we can then use that to inform needs as we look at those every year or every 3 years to address priorities. And as I mentioned, then the environmental scan public participation survey, which we do every 3 years. We've done 2 iterations of both of those. Objective 1.2, which is the actual funding element of the operation, kind of more operational goals in terms of board members reviewing and evaluating grant applications since we approved this plan. You've reviewed over 100 applications. I don't know if it feels that way, but there's been a lot between the core programs and the accelerators. There's been a lot of applications that you all have reviewed since we approved the strategic plan. And that has led to 38 core program awards and 14 accelerator awards. Before today, we were now up to 15 with the approval of the Rosecrans Empowerment Hub. What we do on the financial submission side is strategy C to review those financial submissions. If you see, we, for our core program, process is to have 2 accountants that are staffed here, do a first and second review. Then it will go to me, and I will make sure that the kind of checklist has been followed for the accountant review on those expenditure reimbursements. And then it goes to the treasurer, which is currently Terry. He comes in and meets with me at least twice a month, if not sometimes 3 times a month, and we go over those. He signs those, and then they go to the county health department, who then puts them forward to the county finance committee. So it has multiple layers of review. We're always checking in on this process to make sure it's not overkill or redundant, but every time we kind of go back and talk about it, we're finding that sometimes something's caught in the second review that wasn't caught in the first review, so we believe that these layers are still necessary on the core program review. And then on the accelerator review, because that's a deliverables-based and not expenditure-based, the grant manager, who is, Emily is serving in that role right now, will do the first review of evidence to ensure that the deliverable has met, and I will do a review, then treasurer, and then to on the objective 1.3 grant management, we have looked at creating a multi-tiered system of support. I think that was borrowing some language from the service model within public schools. And we're kind of looking at how to make sure there's accountability mechanisms in place for the funded programs. I think ultimately what we've landed on over the past year is keeping those report cards up to date for board members when you're doing grant evaluations and site visits. So you have that 1-page quick summary of finance expenditures, outcome status, etc., and then having the data dashboard for a more real-time update on numbers served, demographic breakouts. And we have, just as recently as this week, updated the outcome section of that, so you can now see aggregate outcomes. There's about 280 different customized outcomes across the 38 core programs that are customized for each program. And we have organized those into 12 domains. So for example, one domain might be reducing wait time. So we might find, well, multiple programs have their custom outcomes. We see that a certain number of those fall into the category of reducing wait times. And so we've been able to create a cool visualization that shows progress in each of those domains. And then you can scroll to see how that progress bar changes over time.
With a direct service for nonprofits.
direct service
Yes.
projects.
We don't have a.
And then on strategy B under grant management, this is regarding the Learning Network Collaborative. We've started to kind of, we continue to do these, we've started to try to utilize that time to do more interactive activities like the sequential intercept mapping update. For the fourth LNC of this program here, we'll be bringing in Kaizen Health to do an onboarding for the funded programs related to the HIPAA compliant rideshare. Things that are a little more practical and engaging, and we don't want it to just be a report out from us about what the mental health board processes. We want the organizations really learning from one another, sharing information, maybe addressing care coordination within a specific focus area. So that's kind of where we're at with those, but we still do those quarterly and those are required by each funded program to participate. And then finally, in grant management, we have annual site visits. 14 of those have already been conducted for the renewal organizations. And we already have started to schedule for the 24 remaining core program grants, and those will be taking place over the next few months. So we've been getting notifications and emails on those already. Under evaluation of programming, we're looking at collecting that program-specific data regarding the target populations and measurable outcomes. This has become pretty standardized at this point now in the fourth program year, and you see all of that data populated in the data dashboard. Also to measure the efficacy and impact of individual funded programs and their funding utilization. Also, in aggregate shown on the dashboard, we've contemplated, and maybe this is a place for board feedback, if the dashboard should show funding utilization program by program. Currently, that's on the report cards we give you, but that's not been updated for that kind of quarterly or monthly update on the dashboard. And then lastly is looking at the efficacy of the individual programs, overall change on the system of care, the community support system. And I would say at this point, the main activity for that is really that 3-year environmental scan that we do, because that gives us a snapshot of what the community support system looks like in our community. I think Guidehouse has really taken to adopting that lens for their consultancy project and looking through the lens of the community support system. So I think that will further support this objective, but definitely open to other ways of evaluating that if you have any feedback. Any questions, I guess, on programming? Like, so there's going to be an opportunity for you to give direct feedback on each of these, but I want to make sure if you have any questions about the progress or updates that I am able to provide that clarity for you. Yes.
Any thought about unannounced site visits?
Unannounced.
Because then you know really what is going on.
Yeah.
If it is unannounced, whereas announced visit, they are prepared.
When that has been discussed, I have received feedback from the program operators that would be challenging for them because they have to maintain a certain degree of confidentiality with their clients. So, I mean, as a funder, I get there are some abilities to go do that, but
But when we go on a scheduled site visit, same thing. Is that true? Nothing changes.
I would say that's something that would be great to include for your feedback if you think that's something that should be added.
Okay, thanks.
Yeah. I'll also note, sorry, let me get back to this before I forget though, there is really, if you look at our programming metrics as well, we don't have a specific objective or strategy around the small grants that the board has been discussing. And so that might be another consideration for you as you're looking at the programming section, because we have been moving forward with a review of a small grants model based on board conversation and directive. And I don't know that it quite fits into the current strategies and objectives, so I might want to take a look at that as well. So,
Well, if not now, Jason, I was gonna bring it up during discussion, you mentioned Guidehouse a few times, and I would admit that I'm not sure where the entire project is at with them, and was wondering if at some point, if not now, later, we could refresh.
If you don't mind, I have the final discussion item is the supported housing, and I intended to give you an update on the Guidehouse project because they will be including supported housing review, so I can give you a status update on that.
Great.
To that.
Great, thank you.
Questions? Okay, so as we move forward, on the way here, we will look at systems coordination. Please keep in mind that systems coordination really wasn't a major focus of the first 3 years. This kind of got added in the second iteration of the 3-year strategic planning. So we're kind of 1 year into this. So it's a little less further along than that programming element of operation, but we do have some updates for you. So these goals were kind of around structural barriers to service, access to care, things of that nature. And the first objective under access, we see strategy A, which is focused on increasing resources for limited English proficiency individuals who need substance use services. We do have the page with all of the funded program descriptions, including point of contact for program entrance. And we have that in the top, how many languages?
It's now 10.
The top 10 languages
Just
that
added
are
two.
utilized throughout the region. So that is one resource that gets that information out about how to access the mental health board funded programs. And then the Emmaus mental health program is now under contract, which was funded through the Accelerator Award program, focusing on mental health services for the Winnebago County Hispanic community, providing those services in Spanish. And that's not exhaustive of everything that's happening in the county, but those are the things that the board has specifically had a hand in. Forward. Strategy B, which is around transportation services. We are now contracted with Kaizen Health for the HIPAA compliant rideshare. As I mentioned, we're going to be having an onboarding meeting with them next week, I believe, and then inviting them to the 4th Learning Network collaborative meeting to start onboarding the funded organizations and utilizing the platform to be able to schedule rideshare service to mental health appointments as a last resort transportation option. Also under the Accelerator Awards, there were a few transportation focused projects, including the Services Network, which was approved last month and is now under contract, and the Winnebago County Jail Navigator Program, for which the Mental Health Board had funded a van to help do a warm handoff connection for a reentry population with mental health and substance use issues. Strategy C is ensuring the affordability of mental health services. I would say the best thing I can say is our funded program, our core program contracts all require that individuals cannot be turned away based on the inability to pay for services. So that's kind of part of the core foundation of funding. Also, that is something that's being more specifically looked at by the Guidehouse consultant through this project, which we can get more into on the final update. On collaboration and support, promoting the development of referral systems for mental health and substance use resources. I would say the main thing, and this really isn't funded by the Mental Health Board, but I think the board has been a good supporter of this work, is the IRIS technology platform. Does anybody remember the number of agencies that are?
I have it, it's on my slide.
It's on your slide.
So it's over 80 organizations utilize it, and then there's been over 500 referrals through that system to date, so.
So I think the money is there for that right now through, I believe, the CBS Health Foundation grant that was given to Rosecrans. supported by the youth mental health system of care, but continuing to promote that, because, you know, it takes time to get it to scale and to make sure everyone's utilizing it. And then, in terms of resource sharing platform, I'll be honest, we really haven't gone there to a strong degree. I would maybe ask for board feedback on this strategy. Rockford Area Case Management Initiative and the Youth Mental Health System of Care, I believe, have done some degree of exploration in this. They were looking at a platform at one point called PracticeWise that gave like access to evidence-based literature to programs. And I think the feedback I heard was that programs weren't terribly excited about utilizing that. And I think that would be something they would all utilize strongly. So I'm not sure if this strategy remains relevant or if we need to pivot to some different objectives under that strategy in terms of how to move forward. And then finally is the ensuring quality services through promotion of accreditation services and programs. I think this was intended to see how the mental health board could support funded organizations becoming accredited. And I don't really have any activities to report out on that, to be honest. It hasn't been a high priority in terms of all the things that we've been looking at and working on. So and finally, improving and maintaining working relationships with local and state government officials, and I'll just add on them being aware of new policies and implications of local services. And I think the makeup of the board naturally facilitates that, because all of you, as community leaders, connect with other community leaders and hear about, you know, what's going on. And, also through the Mental Health Board's membership to the State Network Association, ACMI, we get a lot of information about what's happening at the state level, some real-time updates on key bills that might be affecting mental health board operations. And so that's kind of one of the benefits, I would say, to getting the activity in that area. And then diversity, equity, and inclusion. We have a strategy around hosting community events, educating community members about the availability of services. We have partnered with NAMI Northern Illinois to host an annual event that all of the funded organizations participate in. That has really been very engaging and had numerous people from the community attend. We're always looking for other events that we can get out to promote information. But generally looking for events that do not have a charge and do not require sponsorship. But if there's events that we can get out to that have a booth that we can share resources, we're always happy to do that. And then pursuing organizational level cultural competence. We have contracted with Northern Illinois Center for Nonprofit Excellence, and they will be hosting 4 cultural competency trainings in April. That will be free of charge to all mental health board funded agency clinicians and staff and board members. One of them will be targeting board cultural competence at board level, and those will also offer continuing education units, which is now a state requirement as of January 1st, that all licensed clinicians have a, I think it's 1 CEU minimally each year in cultural competence. So this will kind of streamline that process or provide an opportunity for those clinicians as part of our funded programs. Finally, on workforce development, looking for social work pathways, CRSS, and medication prescription pathways. I think the biggest update here would be the SWAP program at the University of Illinois College of Medicine taking a leading role in that. I believe that Rockford University has now developed a bachelor's in social work program as part of that project, and there are some participants in that program that are signed up for the master's degree program through the online UIC School of Social Work, and that's just been a really great community level collaboration, and we look forward to hearing what the results of that are and what the future needs of that may be as it relates to continuing to support workforce development in the community. Haven't done anything with CRSS. That is a state, the state is providing funding for that, but no local operators have applied for that funding, no local community colleges or anything. The closest one, I believe, is at the Elgin Community College and Northern Illinois University. And then on prescription, we have the representatives from the College of Medicine here conveniently, and I believe they have an addiction medicine director now, who's going to be starting in August. And so that will really help in this space in terms of one element of that, but I think there's probably more that could be looked at in this space. So, and then Chelsea will give you a very brief update on promotion and awareness, and then, I'm sorry, questions on systems coordination. Trying to be short today. This is a lot of information.
I'll sit on my hands.
Sorry, the mouse goes opposite of.
Well, there's a clicker.
Yeah.
Okay, so actually I want to point out that the systems coordination is actually part of the community support system framework. So that's the actual outer section, and then promotion awareness is actually the one circle right before the spoke part. So this is actually part of the community, the CSS, and so we've really taken a lot more deliberate stance on promotion awareness. Let's turn it on. Okay, so first objective, 3.1 access. Funded programs will create a quarterly social media post and promote their program. So we've had 2 iterations of the toolkit rollout. And so actually this is the pilot year for the core programs on doing a communications tracking form that they submit in Foundit. So this is a good way to have themselves be self-accountable. And then if they are not meeting those requirements, they can reflect that in the reflection section. And then that way from there, I can kind of see whether there are some areas that programs are struggling, and if it's a common thing across multiple programs, I can then provide additional support or guidance on that. Strategy B, funded programs participate in an annual community event. So each year this has increased. So we've had 2 years of building bridges, as Jason talked about. We partner with NAMI Northern Illinois. The first year we had 24 organizations that were funded. So that was a part of program year 1 and program year 2, because we had just had announcements. And then in the second year, which was last year, we had 42 funded organizations. And actually in the past 2 years, when I'm not counting, we've had organizations that were outside of the funded organizations that actually now are funded. So technically, if we go retroactive, there would be more. So from 24 to 42, and then strategy C is that referral system. So as I said earlier, 80+ organizations have been using it, and there's been over 500+ referrals. Next one is awareness. So strategy A, the mental health board will develop a toolkit for funded organizations to promote cohesive messaging about the CSS, funding strategies, and funded programs. So we had a program year 3 version, and we've had an updated version for program years 4 through 6. And we will actually be doing an official kind of rollout through the accelerator awards as well. So they've been given that as well. Obviously some of the, the toolkit was mostly focused for the core, but then, we will acknowledge kind of what the differences are, but at least everyone's getting the same type of content. And then so strategy B, funded programs will utilize that toolkit, provide cohesive messaging. So again, there are key documents that allow programs to have access to. So there's a Dropbox for the programs to have, the logos, the digital version. So say that there might be staff changes. There's one cohesive place where everyone can find those information. Let's be honest, there might be role changes or whatever, so that way it is very easy to find for all the organizations. And as I said, there's going to be a rollout more with the accelerator program. We kind of want to get things more stabilized with the core, especially with the forms. So now those have been stabilized, has been one kind of change, but now they'll be officially rolling out with accelerators. 3.2, awareness. So this is more strategy C, the mental health board annual program handouts and website highlighting CSS. So in the past, we've had, program year 3, there was the actual full-on pages with the program descriptions. That was 8 pages. We realized that when we expanded to 44, that's a lot of pages. Those are not really sharing, conducive for sharing in the community. So we've adapted and changed to a rec card. And now the program's up on the Engage Our One page. So that QR code takes you to that funded program page. So that it's going to be up to date. It will reflect, even if someone gets an old rec card, they will still go to that same funded program page on Engage Our One, and all the program information there is updated in real time. Strategy B, promote the CSS through programs, multimedia strategies, including social media, news media, other communications. So we reshare posts those quarterly required posts of the programs. There's also a press release template in there. So the programs themselves have been sharing, and then we are also cross-promoting those as well. And then as the toolkit has, the co-branding of that information. And then strategy E, programs will participate in community events to increase awareness of the CSS. So we, as Jason mentioned before, we have our building bridges, but we've been at a couple of other community events. So, if there's potential options, let us know, but we really want to focus on more of a mental health focused, of the event. Is it appropriate for us to be there? And then if there's no sponsorship required or no booth fee, we just want to promote the board funded programs as a whole, but there are the funded programs themselves that could be at these events. So with the toolkit that you guys want to have, these programs themselves are cross promoting. So even if we're not there, it's not like the community is not getting aware of the board and the funded organizations. And then the last one is 3.3, promotion. So strategy A, the mental health board impact report published annually, featuring quantitative and qualitative results. So we've had 2 issues of that, so they're 1 year behind. We will be having the PY3, so issue 3 coming out soon. Those typically roll out at our building bridges event, so we'll have those for the community. So those are kind of more those tangible stories, not just data. It really kind of tells a story of what the program's impact is. So we have already been in development of that. We produced that in-house at Region 1 through our grant writer here at Region 1. So they have done interviews with programs. We have, we've had drafts written, and we will, share those later. But that is something that we're currently doing. So it's not just data, it's more of that quantitative information of telling what the impact is. And then we have that data dashboard that is that more quantitative. So strategy B is our annual impact, our annual report, which you guys, encourage moving forward that publishing. So that will be finalized later this month by Community Mental Health Act statute. And then strategy C, funded programs recorded video, the annual impacts presentation. So that was new last year. And so those videos will be coming up for this next program that's ending, so PY4. Those videos will be due at the end of July 2025. So it gives them a little bit of time after the end of the program year to get all their information together, produce it, and have really that high quality video production. And then we will also, per the contract for funding agreements, accelerator awards will also have videos as well. So the timeline of those will be, different because accelerator awards don't have a same cutoff end year. So, and the last one, strategy D, is share highlights of the annual impact presentation report with their own stakeholders. So programs are completing this per their funding agreements. So that might be sharing that video or doing a presentation update at their own board, their higher ups, their newsletter. So that is part of the funding agreement to make sure that's shared with their own agency. I'm collecting that evidence based on what is most conducive or what would fit that for their own organization. So that is all I have. So I actually am shorter than Jason.
Any follow-up questions on promotion awareness?
Chelsea, is there any way to track the number of views or hits, or however we want to term it, on either our website or social media posts, or do funded agencies track that at all when they're promoting things that we've done for them? Is there a way to track that, collect data on it?
So we've had a lot of, with Bitly, we get analytics in terms of any of the QR codes. We also have Google Analytics on our website. So we didn't talk about the metrics of measuring here in this meeting, but those would be something we are tracking those. In terms of the actual social media posts for each organization, some of them actually have been reporting that in their reflection, in the kind of their reflections section. I think, you know, the most part is just kind of making sure they're completing that, but that is something, if we'd like to move it forward, they can report that. Sometimes, you know, one of the reflection sections is there a post that you want to point out that had, you know, more significant reach or performed well? So that is, in a sense, being captured in that reflection section. But in terms of the actual post of like the reach per program, that's kind of as the program itself wants to report.
Okay. Well, apologies if we belabored that. I wanted that recorded though, so that if as you're reflecting on things, you can go back and watch the update, or if board members are not here today, they can have access to that same information. So we will look forward to your feedback. Something will go out, if not tomorrow, then early next week, and we'll just look for your responses and then come back and have some additional discussion at the next meeting to determine if there needs to be any updates to the strategic plan. That, I guess, flows into, if there's no additional discussion there, we can flow into the supported housing needs assessment. And that became an object of discussion at the last board meeting. And what I wanted to report to the board is that that particular issue is part of Guidehouse's consultancy review. So they are looking at 4 areas, and one of those is recovery support services, and under recovery support services, that includes the supported housing. The other areas are specialty care, which is more of that kind of service line view for mental health, outpatient and inpatient treatment. At a health system level, they're looking at crisis response services, and they're looking at early identification, client identification, and outreach. And when I say they're looking at those, they're convening focus groups in those 4 areas. So that's kind of one of the guiding frameworks they're using for organizing this information. In terms of the data collection part of it, the more like hard data outside of focus group feedback, I provided to the consultant all of the data we had collected over basically since the beginning of our operations, including the environmental scan surveys, anything else we have that was maybe secondary that we had from another report, like the Healthy Community Study or something like that. And they have defined, in all of the health systems that are participating have signed off on, to a certain degree, I guess, what data indicators they should be looking at for health system utilization, but I'm not sure if they've received all of that yet. They are trying to work with the health system representatives to receive that health utilization data from the health systems. And so all of that then would be the community kind of level data, the data we have, the health system utilization data, and then the focus group information will make up the core of their data, which will then start to inform the development of kind of an overview of strengths, gaps, potential opportunities for innovation, care coordination, et cetera. I have asked, and I believe that they are if the timeline stays on track, are going to come and present to the mental health board at the June board meeting their preliminary findings and priorities prior to finalization of their actual plan, so mental health board members can have an opportunity to give some direct feedback before the report is finalized.
To your knowledge, are all the health systems participating in the data collection?
I have not been directly involved in working with the health system, so I have no reason to believe that they're not going to provide what they had previously committed to provide, but I'm not clear on whether or not that has all been received.
Have they interacted with any board members here or with you, Jason, and your staff?
I have been, so in order to move the project forward, there was a subcommittee of the advisory committee formed, which includes myself, Dr. Sandra Martell, and Dan Ross as the lead for the funded agency Community Foundation. We've been working with the consultants basically on a weekly basis to give them feedback, review presentations, review email language before it goes out, create rosters for who should be on preliminary rosters of who should be invited to focus groups. So I'm actively engaged at that level. And then the broader advisory committee has a standing every other week meeting that's utilized on an as needed basis.
Great. I think it's the only other question I have, sorry.
No.
What is the state of time frame to be done, quote unquote?
If the data is received from the health systems on this by the kind of deadline that was given, or the hopeful deadline that was given, then it should all be done with final recommendations by the end of June.
By when, I'm sorry?
End of June. So with that, as the discussion item for supported housing, I wanted to bring the board's awareness to that. There was some discussion about evaluating the need for that. I think the need will be evaluated through this consultancy project and then allow for the board to kind of see what was understood and then determine if that should result in a targeted funding opportunity or a deeper dive analysis of that issue.
Is there any type of updates being provided as the process progresses, or we'll just find out?
Yeah, the process is going fast. So it's March. They just started late January, early February, trying to have final recommendations by the end of June. That's a pretty fast process compared to what we've done with even our kind of strategic plan. So I would say the updates, probably the big update is the June board meeting. If there are any key updates before then I would certainly try to bring those to your attention at the April or May board meeting. But I think that will be the one to really plug into is the presentation that we give to the board.
Okay, any other discussion or updates? Hearing none, there is nothing under other matters. So, Dick?
And make a motion to adjourn.
Second.
Captain second, all those in favor, please say aye. Thank you all for coming.